captions come up. Okay. All right. Well, hello, everyone. My name is Jordan Beam. I'm a third-year medical student at the UAB Heersink School of Medicine. And today I'll be talking with you guys about a systematic review that we've conducted on the effects of motivational interviewing on outcomes for patients with CKD on hemodialysis. And my co-authors are Dr. Kavookjian, who is faculty at the Auburn University College of Pharmacy, as well as Heqin, who is a PhD student at Auburn. So, in patients with advanced chronic kidney disease, or CKD, that are normally on hemodialysis, the success of their treatment relies heavily on their commitment to their care. So whether they are motivated to take their blood pressure regularly, monitor their fluid intake and limit their salt intake, as well as exercise regularly and kind of make sure they're taking care of their comorbid conditions. So if they have diabetes or obesity as well. So motivational interviewing is a patient-centered communication skills technique that allows for an open communication line between provider and patient as well. So in these conversations, patients are able to kind of talk out loud and discuss their intrinsic motivation and the benefits that are possible to committing to their care as a CKD patient. So if they are aware and also educated from their physician, if they have been told the benefits, just hearing the patient talk to themselves instead of having the physician educate them, it's more of a patient-centered. So the patient is able to say, I know if I take my blood pressure regularly, or if I know the benefit of taking my medications regularly to the progression of my disease. So motivational interviewing has been shown to be effective in various outcomes across the spectrum and a lot of different conditions across healthcare. So we have different outcomes such as behavioral outcomes, clinical outcomes as well. So it's been shown to significantly affect a patient's BMI, blood pressure, as well as blood glucose. And then we have humanistic outcomes such as quality of life, as well as economic. So that's cost of care and different emergency room and primary care visits as well. So MI has been shown to be effective in patients that receive it in the care of various chronic conditions as well as conditions across healthcare, but it is minimally reported of the impact of MI on CKD specifically. So we wanted to conduct this review of the literature so far and see what has been done and also identify any gaps of knowledge and see where we need to go as far as identifying the impact, if there is one, of motivational interviewing on CKD. So the way that we gathered these studies were a modified Cochrane method and various search and review tiers. So we started with various keywords such as CKD, hemodialysis, and hypertension as well. And so we had two independent researchers that started the tiered review system. So with the initial database records that we found, I keep forgetting you guys can't see, or you can see my mouse, I'm sorry. So I'm going to start pointing. So here's our methods. And we basically started reviewing the literature from we included the literature from 1990 to May of 2024. So in 1990, that was when motivational interviewing kind of came into the healthcare spectrum. So before that, it was mostly in counseling and addiction as well. So in 1990, that was when people really started publishing about this and showing the impact that may be able to be a new kind of approach to talking with these patients and help working with them to improve the care of their disease, their chronic diseases. So two different researchers independently reviewed these studies that were conducted. And at the first tier of review, they were either ruled in or out based on abstract and title review. And then the studies that moved past this stage were evaluated for their full text. So just to make sure that these patients were adult patients that had CKD that were on hemodialysis treatment and received motivational interviewing, or a part of it included motivational interviewing. So at the final stage, we ended up retaining 15 studies, and 8 out of these 15 studies were randomized control trials. So here is kind of a comprehensive list of all of those, and there's a lot going on here, so I'll be sure to do kind of a summary of the high points, but just to if you guys were on the edge of your seat in the intimate details of all of these studies, I have them for you. So we have the authors here, and then we have the general length of all of the studies, as well as the amount of participants or the sample size. And then the intervention group, what they received, as well as if there is a control. Not all studies had controls, but if the studies had controls, what the control group received. So I'll just kind of talk about some of the outcomes that were recurring themes in some of these studies. So sorry. So that's all. No, I have more. Okay. All right. So first we have medication and treatment adherence. So these patients just making sure that they were taking their medications on time, and that's huge for the treatment of their disease. So patients that receive motivational interviewing were actually shown to have more likely to pick up their medications on time, as well as attend their regular hemodialysis visits. So and I want to mention that 15 out of 15 of these studies showed a general benefit of MI and CKD. So while not all of them were significant, actually 9 out of the 15 had some outcomes that were proved to be significant. They all showed the general trend that MI is effective in some outcome in CKD patients on hemodialysis. So that is a very promising finding. And so otherwise on diet and fluid retention, most of the studies that reported these were actually significant findings. So interestingly enough, these patients were able, if they received motivational interviewing counseling, they were able to restrict their diet a little bit better, and as well as monitor their fluid intake. So I think that really just goes into people taking the time. I wanted to discuss a little bit about my third year and being on clinical so far. Physicians sometimes have limited time to spend with patients, and as a medical student and different parts of the care team, you're able to spend a little more time with the patient. So I think this may lend to the benefit of the motivational interviewing provider. Sorry, I don't know if you can hear the sirens out there. Sorry about that. Just the motivational interviewing provider meeting with them multiple weeks, as opposed to maybe a nephrologist visit where the patient may be overwhelmed with information. And although they're a wealth of information at their nephrologist, they may be unable to kind of receive and let this information sink in. So the fact that they're able to meet with the motivational interviewing provider often helps them kind of understand and digest this information and be more likely to commit to their care as well. So we also have serum electrolytes, and as we know, patients on hemodialysis, their serum electrolytes are huge. So making sure that we're monitoring those, and if they get too high, these patients their disease can progress more quickly. So patients that received MI counseling were also shown to have a significant difference in their serum electrolytes. So since these patients continue to be more knowledgeable about their care, as well as be more likely to commit to regular care, they were more likely to have a significant difference in their serum electrolyte levels. So finally, we have patient satisfaction and motivation. So patients that receive motivational interviewing counseling were more likely to be satisfied with their care. And I have another little anecdote from the ward so far. I've dealt with some patients with CKD and other patients with just chronic diseases in general. And something I've noticed is that these patients kind of feel like there's a sense of lost control. So these patients may feel like there's damage that's already been done, or they kind of, relinquish control, that there's nothing more they can do. And so they lose motivation and say, well, I'm not going to take my medicine because, I don't think I can do much more. And so that's what I really love about motivational interviewing, because these patients are able to talk out loud. And if anyone's a fan of manifesting, it reminds me of manifesting in a little way. It shows these patients that they are able to commit to their care. And even though there is unfortunately some damage that has already been done, these patients are able to take charge of their care and make sure that they slow their disease progression. Even though they already have a chronic condition that they are living with, they're able to slow that progression as well. And something else I didn't mention earlier in motivational interviewing that I love is that these patients are able to identify any barriers that they have to their care. So if they have a transportation issue that keeps them from attending hemodialysis visits regularly or picking up their medication, or if these patients have a knee issue or something that keeps them from exercising regularly, these are the kind of things that they're able to, as the patient is sharing their story and talking out loud, that they're able to identify those barriers, and the motivational interviewer can work with them and help them overcome these barriers and make sure that their unique care plan is tailored to them and making sure that they have the best outcomes possible. So in conclusion, we found that 8 of 15 of these studies. I also wanted to mention the RCTs were evaluated for risk of bias, and there was a mild to moderate risk of bias, and that may just be due to social desirability or recall bias of these patients, just making sure that if they were reporting, if they knew that they received and Hawthorne as well. So the physicians unfortunately couldn't be blinded to the care that they were providing. So they knew if they were providing a patient with MI counseling or not. And something I also wanted to mention, these studies were a smaller sample size and also shorter and had a kind of a limited diversity. Why does that keep happening? I'm so sorry. This is all me. This is nothing anyone did. Okay, it's just me. So Yes, so in the future, if more studies need to be included that are a larger sample size as well as a longer sample and include more diverse patient populations, just to make sure we're getting an adequate study and making sure we see the effects of motivational interviewing on CKD. But the results so far are promising, so we wanted to report that. So thank you so much. I'll take any questions.
Thank you. There is a question in the chat, but before, just very quickly, my mother is not a CKD patient, but she is a patient who goes for treatments fairly regularly. And she says when people kind of talk to her and sort of do what this motivational interviewing, she says it makes all of the difference. She said, I don't have a lot of control over what is happening, but it's nice to know that when I can say something, and she comes out of those appointments kind of almost feeling recharged and kind of motivated to continue on because she feels like she's being heard and that she has some buy-in in what is happening when so much is out of her control, because she does have a chronic condition. And so this was really kind of interesting on a personal note to me. So thank you for sharing.
Yeah.
And the question that did come through is, based on the included studies, is there a preferred motivational interviewing framework that is most helpful for CKD patients?
Definitely. So thank you for sharing that about your mother. I'm glad that you had that connection. I'm sorry, but I'm glad that she feels heard. Definitely. That's exactly the idea that motivational interviewing goes for. So for CKD specifically, there's actually not. And something that was another limitation of this study is that all of the studies, they didn't have kind of a cohesive framework. So there is some heterogeneity of the approaches of motivational interviewing that was provided. But I think the theme that was maintained in some of these were regular visits. So it wasn't just one-time counseling. It was making sure that these patients are able to report, whether it was a month-long study or 2 months long, these patients kind of went in for daily or not daily, excuse me, weekly visits with these counselors. And there are frameworks in general for motivational interviewing, but not for CKD specifically. But I think it was just, it also has to be patient tailored. So if the patient had specific hangups, I think the kind of, sorry, I'll go back. So in the initial visit with the motivational interview, I think they kind of have it, it's reminds me of kind of how a therapist would work or a primary visit to any doctor you see or any provider that you see, just kind of getting an idea and getting to know the patient. So I believe that what the patient feels comfortable enough revealing and kind of their barriers to committing to their care, as well as any challenges they've had so far. I think identifying those in the primary visit and then working with those patients specifically with those targets. So I think there can't really be a specific framework for CKD because different patients have different issues. But I do think that in general, the best thing about these studies were that they didn't have a one-time visit. It was more of a longitudinal following that helped these patients really see benefits.